Welcome to H&HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. In this video series, we'll examine how hospitals across the nation are finding ways to reduce both readmissions and preventable harm to patients. This project is brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.
Hello, I'm Matthew Weinstock with Hospitals and Health Networks. In 2011, the Centers for Medicare and Medicaid Services announced an ambitious program aimed at achieving significant improvements in patient safety and quality of care. The agency awarded $218 million to 26 hospital engagement networks, with the goal of reducing patient harm by 40% and readmissions by 20% over 2 years. Totaling $75 million, the Health Research and Educational Trust has one of the largest so-called HEN contracts. HRET is working with 31 state hospital associations and nearly 1,500 hospitals stretching from Alaska to Florida to develop methods for sharing best practices across the delivery system. But achieving CMS's lofty goals won't be easy. Over the next 7 months, H&HN will visit a couple dozen hospitals and state associations across the country to examine their work in the HEN project. We'll bring you their stories on a regular basis in H&HN Daily. Right now, I'm joined by HRET President Malik Joshi to talk about the progress he's seen thus far in the project. Malik, thanks for being with me today.
Thank you, Matthew.
So give me a little bit of a progress report on where your HEN is over the past year and a half. What kind of improvement have you seen?
Well, over the last year and a half, we are so excited to see some pretty impressive improvement on many areas. As you know, the Hospital Engagement Network is working across 10 clinical topics, and I'll just pick two. One is on early elective deliveries. We know babies born before 39 weeks is not good. Increased chance of complications, increased chance for the baby to go to the NICU. So we have now worked with, again, close to 900 hospitals in the HRET Hospital Engagement Network, birthing hospitals, and we've been able to lower the percent of early elective deliveries from over 15% to less than 10% in a year. Dramatic improvement, and that keeps going down. That is great for mothers, great for babies, and improves the cost savings in this country. The second part, one we talk about often, is readmissions. We've now worked with close to 600 hospitals in our network, and in the last year and a half, we're seeing a readmissions rate reduction of over 10% in just a year and a half. And that continues to progress. So we've got results across many areas, but those are two that we focus quite a bit on and seeing really impressive work from our hospitals across the country and our 31 state hospital association partners.
And so you mentioned early elective delivery and readmissions. Are there other of those 10 that you're seeing significant improvements on?
Of the others, we're seeing a lot in some of those infection areas, catheter-associated urinary tract infections, central line-associated bloodstream infections that the Agency for Healthcare Research and Quality has funded over the last several years, and now that work is continuing on in the HEN, surgical site infections. So those bundles continue to show improvement. Some of the areas that we're challenged by are things like adverse drug events or pressure ulcers and patient falls with injury. The reasons are actually kind of very clear and gives us information for what we do in the future. Adverse drug events, we all are working on it, but there's no one measure nationally to look at. And that makes it hard as we all work on different measures and try to help improve. It's not a barrier, but it makes it a little bit harder. Patient falls, pressure ulcers are two areas that cut across the whole hospital. And it gets again to how we're doing very well on projects where we have a defined team, a defined area, and can focus on the work. When we cross across units and talk about care coordination and other things, it makes it more of a challenge. Still making progress, but more of a challenge.
So at the outset of this project, CMS set some pretty lofty goals. In your mind, are those attainable?
Absolutely, they're attainable. Every CEO today in the hospital thinks about preventing harm and preventing readmissions. Those are two areas that are common. These all feed into harm reduction and readmissions reduction. So yes, 40% reduction in harm is very hard in 2 years. 20% readmissions is very hard in 2 years. But I think they're the right goals to have for us to aspire to. We want goals we have to aspire to versus ones we know we can make. And that's not coming from CMS, that's from us as hospital leaders. And so we think they're achievable. It'll be hard work, but we're going for it as fast as we can.
But as you said, you've got 600 on the readmission front that have reduced it by 10%.
Right.
So we're coming towards the end of this 2-year grant process.
Right.
So again, do you think you're going to be able to reach that 20% mark?
So a couple of things we know from improvement. It's not all incremental and at the same pace. So in the beginning, it might take a little bit time to go from 0% to 50% to 70%. It might then inflex to go even quicker when you go from 70 to 80 to 85 as you hardwire these processes in. So that's where we think we're at. We have now made improvement and we can now accelerate the pace of improvement. It's not a arithmetic kind of change, it's a logarithmic change, we believe, and we'll see that in the results in a short period of time.
So it's building blocks, one on top of the other.
Absolutely. And the other building blocks that are not even part of the clinical topics, leadership engagement, physician engagement, culture, those all get put in as well. So they form that foundation to really accelerate the results.
So on that leadership front, talk to me a little bit about how your HEN has reached out to hospital leaders to get them engaged in this process.
Absolutely. Well, leaders are so key, as we know. In today's complex healthcare environment, we want alignment more than adding any complexity to the organization and to the work. So we've reached out and we've had senior leadership meetings where we invite CEOs, CNOs, CMOs to the meeting, have them hear best practices from their colleagues and peers, and then design their action plan. What are they going to do in the next 30 days to support these topics, the next 90 days? So that's been a very informative and helpful way to get the teams to see their leaders there and to work together on their shared aims. The second part is we're very transparent. Data goes a long way, and so we share with all our hospitals and all our states how they're doing. How are they doing on submitting data? What percent improvement are they getting? And that drives the improvement because they can see others doing it and we can facilitate that learning from others.
And so how are your hospitals and associations doing on the data front? I imagine you have some that are perhaps doing more than others.
I can tell you back in September, we were at a low level of what percent of data hospitals were submitting. We were ramping up and building the infrastructure. In the last 6 months, we've tripled the amount of data submission from all our hospitals.
So I want to come back to the readmission front a little bit. We've had close to 2,000 hospitals take a hit on their Medicare payments for high readmissions based on another Medicare program. What kind of pressure does that put on hospitals in the HEN to focus on readmissions?
I think this is the beauty of the hospital engagement networks. We're working on topics that we know are being publicly reported and are being linked to payment. So whether it's the readmissions penalties or value-based purchasing, these are areas that help enable and serve as accelerants to the work we're doing. So yes, it puts pressure, but we view it as an opportunity. HEN gives us an opportunity to work to improve those areas well before all the penalties and other things kick in.
And HEN, of course, isn't the only effort out there to try to improve patient safety and quality of care. There are a bunch of other initiatives, whether it's Joint Commission or IHI. How does a hospital executive sort of sift through all this information that's coming at them?
If I'm a hospital CEO, a couple of things. Again, the agenda for our trustees and for our leadership is around two big quality goals: reducing readmissions and reducing preventable harm. Those two are common and must be focused on laser-like. These all fit into that. And so I think that alignment is so critical. We're not adding to that. The 10 topics in the Partnership for Patients all fit under harm or readmissions. The work that IHI does fits under that. The work that others do fit under that. So I think the message to the CEO is how do we align all this work, report it in a way, measure it in a way, and improve in a way that helps our patients and gets to our mission.
And so lastly, Malik, the HRET HEN has developed a fellowship under its program. So can you talk a little bit about what that fellowship is and really how that's going to help sustain these efforts when the HEN grant goes away?
The Improvement Leader Fellowship that the HRET HEN has created with our 31 state partners, to me, is the lasting legacy for this project and for the work for years to come. By building the skills, the experience, and the networking of now over 900 improvement leaders across the country and growing, we're now building that cadre of leaders for the future. And so when there's other topics to work on next year and the year after, we have individuals steeped in the science of improvement and the ability to execute in their own organizations and work with their teams to do that. So we think it is one of the jewels of our program in terms of creating that workforce today, that energetic group that's going to lead it, and then continue on and pay it forward for years to come.
Malik, thanks for being with me.
Thank you, Matthew.
Starting next month, H&HN will bring you interviews with hospital leaders and frontline staff who are working to achieve the HEN goals. We'll be on location at nearly 20 sites. The videos will come out on a regular basis in H&HN Daily and be housed on a dedicated website. So stay tuned. For H&HN Daily, I'm Matthew Weinstock. Thanks for watching.
Thanks for tuning in to H&HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.